It's an addiction, a tough, painful thing to break. We're going to talk to a recovering addict about a new rapid detox that he's hoping will keep him clean and sober. All that ahead. First, well, overcoming drug addiction is time-consuming and excruciatingly painful. But there's now a procedure that promises to speed up the process. As our senior medical correspondent, Dr. Sanjay Gupta, reports, for some drug addicts, it is getting easier to become clean and sober.
You're ready. In the Basketball Diaries, Leonardo DiCaprio is acting the pain of drug withdrawal. But 28-year-old Valerie Cootie wishes it was just an act for her.
You're cold, you're hot, you're anxious, no sleeping. Your body just craves the drug.
In this case, the drug was an opiate called Percocet, a prescription pain medication. Her story is not uncommon. A federal study shows 1.5 million of the 30 million patients who used prescription pain relievers in 2002 became dependent. Years ago, after a knee operation, Valerie was prescribed Percocet for post-operative pain. Soon, she was popping 20 to 30 a day.
It's almost like you can function better when you're on them than having to go through withdrawals.
Scared of withdrawal, but knowing something had to be done, and quickly, Valerie tried a relatively new technique called rapid detox. Typically, a person is weaned from drugs slowly. With rapid detox, patients are given anesthesia and then given an opiate-blocking drug called naltrexone that causes nearly immediate withdrawal. Now, if naltrexone were given without anesthesia, the heart rate would increase, breathing would become labored, and the patient would feel violently ill. But the anesthesia seems to block all those ill effects. And detox can be almost immediate, just a few hours instead of weeks.
They're very excited when they wake up and they're not craving, they can't believe it.
Still, patients do require several days in the program for medications and further counseling, and some doctors worry about the risks of general anesthesia. For Valerie, it worked, and life is better without the haze of Percocet.
I can look at my little boy and enjoy him because I will never have those times back.
Dr. Sanjay Gupta, CNN, Washington.
Well, joining us now from Kansas City, Missouri, a man who's been addicted to OxyContin for 3 years. Last month, he underwent rapid detox. We've agreed not to use his last name. Greg, we appreciate you joining us tonight. Thanks very much for being with us.
It's good to be here, Anderson. Thank you.
Let me ask you, what was withdrawal like for you under this rapid detox?
Withdrawal with this rapid detox actually was nothing that I thought it was going to be like. It actually came out 110% better than I thought that I was going to be able to do it on my own. But I really think that this program helped me out a lot. And
but I mean, did you have the physical pains of withdrawal, or were you out for the whole thing?
I was out for the whole thing.
I know you started. You had pain, and that's why you were prescribed OxyContin for after some back surgery. What was it like being addicted to it?
Oh boy, to be honest with you, it was up and down. Most of the time it was horrible. I just sat back and I'd think to myself when the next time I was going to take one. I mean, I was taking so many a day, and I just really didn't know what to do with myself. You know, I just made myself occupied enough to sit there and try to think to myself, I don't need it, I don't need it. But as the time came, I kept on taking more and more throughout the day to where it got myself to where I was such a high that I just really didn't know what to do with myself anymore. And this just went on for, you know, like I said, for quite a while, for about 3 years. There was a time I did try to detox, though, myself, and didn't really work too well. That's the reason why I went through this program. What
was that like, trying to do it on your own?
On my own, it's terrible. I mean, the withdrawals, you got hot and cold sweats. I mean, insomnia, it just feels like somebody just pulled your heart out of your chest. It's the worst thing you could go through.
You know, there are doctors...
Basically, like...
I'm sorry, go ahead.
It's just like, I mean, having 5 times worst flu you've ever had in your life. I mean, that's basically the best way that I can put it from my experience. You know, it's horrible. It's the worst thing you could ever do.
There are a lot of doctors, though, who say, you know, who warn against this rapid detox, basically saying you're under anesthesia for a long period of time. They warn against that. Did you have concerns going into it?
I had a little bit of concerns. I didn't really have too much. I did some research and everything before I had actually gone down there and had the detox done. And a lot of the information that I'd gotten, you know, feedback-wise before I had gone down there wasn't really what I wanted to hear. But it was, once the phone call got made, it kind of calmed me down and said, okay, I can do this.
Well, Greg, it takes a lot of courage just to try to lick this thing, and we appreciate you being on the program and wish you a lot of luck.